If you are a massage therapist and you've been struggling about your health lately, your mental health, gut health, and everything, then this video is for you. Hi, my name is Steph, the massage therapist, and welcome to another episode of Massage and Whatnot, where we talk about massage therapy from start to finish. So if you're ready, let's get started. Hi, how have you been? I missed you. Yes, last week's episode is more for our students, but this episode is for you as a massage therapist. Doesn't matter if you're a new massage therapist, a teenager massage therapist. When I say teenager massage therapist, what I mean is like 10-year-old massage therapist, like 10 years in experience. Anyway, senior massage therapist, or you're in the pioneering, you're already up there type of massage therapist. You probably have a lot more tips than me, but this is just based on my personal experience. A story of how I ensured that I can keep up with the demands of my practice. Yes, so for the past few months, you haven't been seeing me. I have been going through a lot personally, not nothing bad, but it's something to be that I need to be working on, which is basically my health. I just felt that it was too much for me teaching, tutoring, massaging, growing my business, taking care of my house, my husband, my kids. I don't have kids. I have dog kids. And now I have another puppies on the way. There's a lot of things going on. And there were a lot of good opportunities that I had. A new job position that I took. Again, it's a once a year thing. Nothing crazy. It's good for my resume kind of thing. And it's a good for experience. And then I realized that it has been quite a battle. Well, that's my story at least. But what's yours? What's yours? Let's start as a beginner RMT. Okay? Because for the most of this episode, it will be more focused on new RMTs, like 5-year-old max RMTs. And the other rest of years of the RMTs, if you're watching, I want your opinion on it. You can comment it down below. Give us insights, right? The reason why I can't give a lot of insights for senior RMTs or like pioneering RMTs or that has been practicing 20, 30 years is because I'm not an RMT like that yet. But this is why I'm still inviting you to listen, because maybe I'm going to say something right, or maybe I'm going to say something wrong, or maybe you're going to learn something from me, or vice versa. So if you have any advice, comment it down below. My number one advice when you're beginning your practice is start small. Yes. When I started my practice, I just worked in a massage addict 6 days a week, earning very less. And I thought that was enough. But then I started to hear that my colleagues are earning more working outside. And then I realized, I need to go out and work somewhere else. And then I did. I earned more, but then I realized that, they're not that busy. So it's the same income I'm earning from the massage addict clinic. And I was like, is it worth it to move though? And that made me had more stress about, is this the right career for me? Because it's really exhausting to become a massage therapist, especially if you don't like it. And at that time, because my mom forced me into this, I didn't like it that much yet. But then as I grow old, as months, went by, I realized that there's more to this. There's a lot more things that massage therapy can offer. I can teach. I can make YouTube videos like this, but I didn't realize this now. I mean, not now. I realize it now, but not then. In the beginning of your career, you're going to feel that the world is your oyster. There's a lot of things you want to do. Like that simple thing. You start small, but That's too small though. You're just jumping from one clinic to another clinic. This is when you start upgrading yourself. Take courses. Remember when I said I went to the other clinic and it's not that busy? I forgot to tell you that there's a factor for that. I'm a new RMT and the rest of the RMTs there are good. They have extra modalities that they can offer. Their hand work are better than me. Don't be too sad when that happens because not all patients would like one therapist. Like, for example, not all of the patients I've seen in my entire career likes my method of massage. I mean, they might not tell me right away. However, they might not come back. Like, I see some retention. I'm good with retention. I'm very busy in my massage practice. However, in the beginning, that's a hard thing to do. So what did I do? Invest in courses. Take simple courses first, like something generic, hot stone, cupping, stretches, fascial stretch. I know some courses are really, really pricey, but think about it this way. It's an investment. The Swedish techniques you learn from school are the basic ones. You can still survive using them. However, everybody deserves to have an upgrade. Do you understand what I mean? It's not always a bad thing to have an upgrade. And to be honest, that's what I'm feeling right now. Now that I'm almost a decade into the practice, I passed the 1 to 5 years type of thing. I feel that the courses I've been taking are, I grew out of them. Like I've been using them too often that I need an upgrade. But that's for later. For today, if you are a first year to a fifth year RMT or a massage therapist working, baby steps. Okay? Also think about longevity. Don't just think about, oh, I'm gonna make sure that I hustle now. I mean, you can, depends on what you need. Like that's what I did. I hustled so much on my first, second to third year that I opened a big clinic because everything is possible if you put your mind into it. But then I forgot a lot of stuff. I focused on business. I forgot to hone my skill, but at the same time, I'm taking extra courses. I'm honing my skill, but at the same time, I'm not really using it in practice because I'm doing business a lot. So I'm jumping from one thing to another and another because that's a normal feeling when you're a first to fifth year RMT early on those stages. You kind of want more. Dreams are there. I want to open a clinic. I want to start a clinic. I want to do this. I want to do that. Is it a wrong thing? No, it's not really a bad thing, to be honest. Dreaming about having a big clinic, dreaming about your home practice, it's not a bad thing. What's bad is when you do not prioritize things accordingly. My mistake when I opened that clinic is I did not have enough money. I forgot that I need to live too. I forgot that I need to pay for transportation. I have to help at home. I have a lot of other people that might get hurt in the process, but I wasn't thinking about it. If I waited a little bit longer, would it make a change? Maybe yes, maybe no. But if I prepared a little bit better, I may not even need to experience what I experienced when I opened my business, which is the financial hardships. It was really hard because I wasn't prioritizing things. Because again, as a new RMT, everything is new. You see this, you see that, you kind of get the gist of everything. You join a clinic, you want to do their business because you think you can do better than them. You open your own practice and realize, oh, it's so hard. But you're stuck in a 1 year lease. You can't afford the lease. What I'm saying is before you jump in and do things, really think about your mental health as well, your gut health as well, your hormonal health as well, your family, your financial health. Think about all of these things first before you actually jump. Okay? Well, do I regret that I opened a clinic so young? I opened a clinic around 20, 22 to 24 years old. It was a big clinic. It wasn't a small independent practice. It was a big old massage therapy clinic. It's a multidisciplinary clinic. We had employees. I had to pay employees, payroll, those things, tax, everything, like a 50-year-old person would. I did all of that at 24. I'm now 28. Don't look like one. I'm too stressed. Yeah, I know. But what I'm trying to say is there's nothing impossible. But again, I started when I knew nothing. But do I regret? No, I don't. Because my experience then is the reason of why I'm talking here to you right now. Because I know the feeling of failing because I'm ill prepared. I'm not prepared. Because when I was a young RMT, everything is shiny and everything is achievable. This is not a video of telling you don't follow your dreams. What I'm saying is follow your dreams, but prepare accordingly so you don't feel burned out. Let's say you don't want to have a business. You just want to work, you just want to work normally. Sure, work normally. Now you need to prepare for the other stuff in your life. Your health. How are you helping your hands? Right? Yeah, exercise, gym and stuff. But how about your joint health? Nutrition is important. Why am I suddenly talking about nutrition? By the way, this is not on my scope of practice. This is just me talking about my experience. I had one of the reasons why I've been away is because I really was prioritizing my health. My gut health wasn't so good. So I had to make sure that my diet is good. And one of these things that helped me is making sure that my joint health are good. So I went to a naturopath, ask for advice in how am I going to help my joints, maybe turmeric or something like that. But again, don't take that advice directly from me. Go see a naturopath, okay? Go see a doctor or something like that. Just see your options, wellness options, right? I changed my diet. I made sure that I had time for family, friends, and really ensuring that this and this, my brain and my gut health are okay. So my hormones are okay. Everything is okay. And yes, I'm not building a clinic now, but I have a tutoring business. I teach at school. I'm a program coordinator, and on the side, I do events. I do a lot of things. Yeah, because that's who I am. I don't really have a full-time job because my full-time job is being self-employed. I need to put money on the table, and that's stressful. So now that I'm almost 10 years in, after my 5-year mark as a massage therapist, I focused more on my health and realized that the right time would come to you. And when it comes and you're prepared, everything would be a very sweet, sweet, sweet spot for you. Yeah, that's how you can reduce all of this burnt out, right? I don't know if it really makes sense what I'm trying to say here, but that's my experience, and that's what I've been hearing with my other students, the students that I had from before. They're around 1 or 3 or 4 years in the career now, and they're telling me that, oh, I'm very tired, I'm very exhausted, I feel burnt out. I always tell them, what's your goal? Is money your goal? Because if money is your goal, there's a lot of ways to earn money smart than hard. Instead of working 6 days a week, maybe you can work in multiple clinics half day, 5 days a week, or, until you can figure out a good schedule for you, but with more money. If it's about health, or let's say gut health, and you don't have the time to cook, maybe but you have extra budget, maybe, subscribe to HelloFresh. By the way, this is not sponsored. Something like that. Like get something that can help you manage your life better. I have a lot of that. I have to figure it out. Maybe learn how to budget, like find a way on how to budget your stuff. There's a lot of personal things that's going on with us massage therapists, and it's really hard to like keep it up, especially with the type of job that we have. But what I'm trying to say is if there's a will, there's a way. There's always a way. It might not be right away, but it'll come to you. Just prepare yourself for it. I know I may still experience more as I cross my 10-year gap I mean, not a 10-year gap, a 10-year RMT time. After that 10 to 15, I might experience something else. And 15 to 20 years later, I might experience something else again. But what I can foresee right now is if I pace myself without pushing my limits, knowing my boundaries, that can help me with my burnout. Okay. Knowing what I need to prioritize is something that we massage therapists can do. This is one last story I'm going to say, and then I'm going to ask our senior RMTs. Okay. When I was, like right now, my home practice, it's not as big as the old clinic I opened or the other clinics that I've opened, but it gives me money. I'm not worrying about money so much. I mean, I still worry. But unlike when I opened businesses before, this has been a bit easier for me. And the question of, am I going to open another multidisciplinary clinic is popping up in my head. And to be honest, I still have trauma for this because of what happened to me. But it's a learning lesson, like I've learned that there are other things that I could have done. And now that I'm building this home based practice, I'm applying those. But at the same time, I'm earning better. Okay. And that helps me reduce my stress. So now I can focus on other things that I need to be focusing with. So that's just my advice to you. And now that you're listening, I kind of want you to reflect what you really want within this time period. Okay. This is now my question to the senior RMTs that are 10 years and above. Comment down below what are the things you can add on to what I've said. Because this is just me blabbering about what I think would help other people. And I'm not saying that this advice is the only advice that people should take. Because my experience might not be the same experience as other people. Maybe other people are experiencing something else. So for those pioneering RMTs or massage therapists, what would be your advice to me, to us that's still growing in this field? What are the other burnt out activities, not burnt out activities, the to remove this burnout that we're feeling? Right? I know we need to go for more massages, spas, exercises. Those are the generic stuff. What I talked about today is what I did to remove this burnt out, but I have a long way to go. Right? I picked different careers, teaching because it's less stressful. Sure, that helped me reduce the burnout I'm feeling, but I'm starting to feel burnt out again. So, you know what I mean? It's an unending cycle. So, what do you think? Right? Or maybe as a new RMT, do you have any contingency plans that you want to share us? And see, how can we really enjoy the longevity of becoming a massage therapist and fight burnt out? Because we're all burnt out. And when a massage therapist is burnt out, it reflects on our work. Patients know that, just so you know. So yeah, comment down below on what do you think we should all do besides of what I said about this podcast episode, because this is just me chilling, asking a thought out there, because I've been noticing there's a lot of comments about burnt out, and I want to share my experience, as this is the only thing I can offer and how I can answer these questions. To summarize all of this, we have to keep dreaming about what we want. Let's not stop doing it. However, we also need to prioritize what we need to do first so that we are prepared, because we can't not just jump without knowing, or we're going to regret the things we've done, or we're going to have a hard time. Even if it's hard and it's not possible most of the time, but prioritize yourself. Like, I know that I'm not a mom yet, but I am not saying comparing my kids to the dogs, but I have other priorities. I have a lot of dogs. I have a lot of bills to pay. I have a husband to take care of. We have different problems all in all. And I also experienced a time where I feel like nothing's working. But one thing saved me with a burnout. Take a breather, take a rest, think, apply, and if it doesn't work, take a breather, take a rest, think, and then try again. And if it doesn't work again, do the cycle. Stop, take a breather, take a rest, try again. If it doesn't work, repeat the cycle. It's a trial and error process until we get the right amount. So again, my name is Steph, the massage therapist, and thank you for listening for this podcast. I hope I gave something to answer this question that has been asked to me. I hope this have a little bit relevance for you. But yeah, thank you very much and see you for the next episode. Don't forget to like, share, and subscribe this video. Bye-bye.